Thank you once again for joining us today. Chronic diseases are the leading cause of death and disability globally, affecting millions of lives and placing substantial demands on healthcare resources. As these conditions require ongoing management and care, tech innovations offer new hope of improving patient outcomes, enhancing quality of life, and reducing healthcare costs. So with me today, I have this esteemed panel of Julie Fishman, Alexander Blood, Mohammed Datu, and Anand Iyer, who bring a world of experience and come from eclectic backgrounds to really help tease this out and really understand from their perspectives, how are we leveraging health technologies to improve the lives of patients living with chronic conditions? Where have we made good progress and where remains room for improvement, and what the future holds for us? But before we jump into the meat of the conversation, would love to do a quick round of intros. I'd love to hear from each of you, obviously, what you're doing and how your current role relates to chronic condition management, just very briefly, and then a fun fact about you so the audience can get to know you just a little bit better. So maybe we'll start with you, Julie.
Sure, and hello, and thank you for having me. I'm Julie Fishman, currently Head of Commercial at RxPlus division of Astellas. Astellas is a global pharmaceutical company headquartered in Japan. And at RxPlus division, we pioneer novel evidence-based healthcare solutions that provide personalized, accessible, and effective care to patients in real time. So our technologies are digital type of technologies. A little bit about my background. I'm a pharmacist by training, spent most of my career on the business side of healthcare and life sciences, but I started out my career as a practicing pharmacist in New York City area, and really had a firsthand exposure to working with patients who have chronic conditions and come from very diverse cultural and social backgrounds. So really know what it's like for patients and for providers who care for those patients.
Wonderful. And a fun fact, is that your fun fact?
No, my fun fact, actually, thank you for reminding me about the fun fact. I've recently tried kite surfing as a new fitness activity. I've never done this before. It looks amazing. It's very exciting. It's also very difficult.
Awesome. Welcome, Julie. Anand?
Yeah, no, good morning, good afternoon, everybody. And Chandra, thanks for organizing this. Such great to be with such a great panel. Anand Iyer, Chief AI Officer of WellDoc. For some of you who know me, I'm also a type 2 diabetes patient who consumes our product. But WellDoc, we're a digital health company, and we focus on helping patients who may suffer from cardiometabolic health conditions such as diabetes, heart failure, hypertension, weight, sleep management, and their healthcare providers to better manage their condition and get to a better place using digital tools. The way we do that is we provision an app, if you would, that's an FDA-cleared app to the patient that effectively allows them to enter data. The data could be entered in a number of different dimensions: their medications, their metabolic entries like their glucose, blood pressure, weight, their activity, their sleep, and they get real-time coaching and feedback that's precise to them at that point in time. But then they also get longitudinal feedback on how they're doing, how they're progressing, if you would. All of that data is, of course, delivered to them in an AI-driven format. There's no human coaching here. It's all what the FDA calls software as a medical device. But then the healthcare provider is also privy to that, and the two of them work together. You're using technology to bring the patient and the provider closer together such that the provider can then use their clinical judgment based on the patient's actual data and trends to say, you know, we can optimize therapy here, there, and whatnot. We see a very scientific, if you would, journey that we followed, evidence-based journey that we followed. We see typical outcomes of multiple points of glucose A1C reduction in the tune of 2 to 3 points, oftentimes 7 to 12 millimeters drops in systolic blood pressure and improvements in weight, and significant economic cost savings to the payer. A fun fact about me, if you see me doing this with my fingers, it's because I'm a professional Indian drummer. It's not because I'm nervous. And so I tap on anything and everything around me. Sometimes it annoys people, but I'll try to keep my hands still for the session.
That's awesome. Welcome, Anand. Mohammed?
Hi, good morning, good afternoon, everyone. You guys can call me Mo. I'm the Senior Director of Global Commercial Digital Health here at Johnson & Johnson. I'm hoping everyone knows who Johnson & Johnson is, but if not, we are a healthcare company consisting of medtech, as well as our pharmaceutical division, which is called Innovative Medicine. My team looks at digital health opportunities really across the spectrum, whether they're internally developed on our R&D teams for the purposes of clinical trials, or looking at external partnerships to really determine, one, what the real-world application of those digital health tools and opportunities are, but also see, what the global scalability potential of them is. Background about myself, I'm also a pharmacist like Julie. I also worked in pharmacy early on in my career, been in life sciences for the last 10, 15 years or so. And then prior to joining J&J, I came from a digital health startup, which is unfortunately no more, called Pear Therapeutics. Fun fact about myself, I actually was pinged on LinkedIn because one of my elementary school classmates was supposed to be attending this webinar. So Rudy, if you're here, thanks for joining, and hopefully we can connect after.
I love that. Welcome, Mo. And finally, Alexander.
Hey, greetings, everybody. I generally go by AJ. So AJ Blood, I'm a practicing cardiologist at Mass General Brigham, based in Boston, Massachusetts. Mass General Brigham, very large research and clinical care powerhouse here in the Northeast in the United States. My team, the Accelerator for Clinical Transformation, is a research and implementation science group within Mass General Brigham, where we develop and deploy digital tools and therapeutics. We run remote clinical trials as well as implementation programs across our system for everything from digital therapeutics to implementation science across the cardiometabolic spectrum, where we do trials in hypertension, hyperlipidemia, heart failure, type 2 diabetes, and obesity. Fun fact about me, I'm Dr. Blood, $5 for a new joke, but my better half is actually Dr. Fresh, and she is also a cardiologist, so we are the Fresh Blood
family.
Yeah, so fun one.
I love it. Welcome, AJ. So we'll jump right in, but before that, just a quick heads up to everybody. This webinar is being recorded and will subsequently be hosted on the HealthXL platform. And I encourage you to send your questions in the chat or in the Q&A throughout, and we'll try to address as many of them as possible. So let's jump right in. There's so many chronic conditions and so many gaps in care within those. But as you look at that spectrum, right, through your lens, and especially maybe as J&J, as Astellas, as a physician, which problems do you look to solve and why? How do you pick the right one? Is it adherence, behavior change? Which one do you pick, and how do you do that?
And maybe I can start. So we look at all of them. From a pharmaceutical standpoint, we are very in tune to our patients and really understanding the patient journey, and really trying to dissect what are some of the challenges that our patients are facing, right? Is it that they're being misdiagnosed or not being diagnosed in time? Is it that they're trying and failing medications nonstop that leads them to suboptimal outcomes? Is it adverse events? Is it compliance, persistency, whatever it is? We'll look across the patient journey to really understand what are some of the challenges that our patients are facing, how do our products align to helping with some of those challenges, and then trying to understand how digital health can play a role in closing some of those gaps, and at the end of the day, ensuring that patients who would benefit from the treatments that we make get access to them.
So maybe going after Mo, because we certainly have some synergies. We also look at the patient journey holistically and the challenges that they experience. Care also look at the some of the largest groups of population where we, where there's unmet medical needs. We have a bit of a more tailored focus on oncology, cardiovascular diseases, and stroke. We don't align to our pharmaceutical portfolio, so we have to have a focus, in order to be successful. But yes, in a similar fashion, look at the opportunities where we can solve across the entire journey, from diagnostics to prevention to post-care management.
Yeah, I'll build on that, and I'll use the vantage point of me as a patient, folks, which is when I first got diagnosed with diabetes, all of a sudden I realized I have to do something I never did, was measure my blood glucose. I have to be careful about what I eat. I have to exercise. I have to sleep properly. And all of a sudden, you're asking somebody to essentially turn their lives upside down and do A, B, C, D, E according to the standards. And, there's this little thing called life that gets in the way every now and then. It's the honest truth. And so I think it's important for us to look at the totality of what it is that we're asking from a patient, but do it in a way that they can absorb. Do it in a way that they can then govern and manage. Maybe people can't do 2, 3, 4 changes at the same time. Let's meet them where they are. And I think that's the power of digital health. Digital health can, if you would introduce these topics and introduce these behaviors to then sustain over time, but they can introduce them in a way that's commensurate with the patient's ability to absorb them, so that they're not being thrown all these things to do. It can actually tailor what needs to be done and get them to a better place in a way that they're comfortable managing with their healthcare provider. And I think that's something that traditional medicine and pills alone can't do. It's looking at the 360 and helping them do it in a way that's comfortable to them.
A lot of great nuggets in there already. I don't need to recreate the wheel, but just to add maybe a little bit, I think one way that I try to frame it is, how do we both make it easier and more efficient to deliver and consume healthcare? So that's both for the providers, the patient, and the system in between. So driving efficiencies and scalable practices in and amongst each of those nodes in that patient journey, I think is a really strong way to start addressing that problem. But I'll also just throw a little bit of a wrench in the gears there, because I think the true answer is it depends very much on the disease state, the patient, the environment. So I think you're going to have to contextualize that answer for the appropriate situation that you're facing. And that will change based on the condition, the patient, and the system that they're living and working in.
Yeah, 100%. Go ahead, Julie.
Yeah, this is actually a really good point, because we have to think about value across the entire ecosystem of providing healthcare. So there's never just one stakeholder, and it's never 2 stakeholders. It's a multitude of stakeholders, intermediaries. We really have to think carefully what type of value they're looking for and what type of value is realistic to deliver.
Based on this, either the products you've brought to market or your direct experiences with patients, what are the traits of a solution that supports management of chronic conditions, so living with chronic conditions? What are the traits and qualities of a good solution, right? You can think about it from the point of view of form factor, or just like Anand said, how does it integrate and blend into your life? I'd love to hear what has worked, and that's the type of solution you want to really double down on and help reach more people.
I can start again, but I think there's not just been one. I think that the solution really needs to align to a very clear problem. And if you look at just some of the examples of solutions that have kind of taken off, right? So continuous blood glucose monitoring, right, is a digital health solution that has, the problem that it solved is that when you talk to diabetics, right, what's one of the biggest areas of burden for them, right? It's constantly having to test their glucose levels, right? They have to prick their finger, they have to carry on Lancets, all the baggage that comes with it. And now you have a clear asset here, a solution that not only solves this problem, but makes it easier, but then also empowers the patient to have data and insights to take control of their health at the same time. Right now, you have these devices that are interfacing with their smartwatches or their phones, and they're able to get notifications when things may get up or down. There's apps now that can look at patients' trends based off of their mood or how much they've slept or what sort of exercise they're doing. Right, so you took a very complex problem, simplified it, but then you also enhanced it to where now you're empowering the patients with data, insights, and all these things where they can further take control of their disease.
Yeah, I'd build on all of this, folks, and say that for us at WellDoc, people ask us this, and they've certainly asked us this as one of the first movers in this space of what actually are the ingredients for success, or what do you see? What has the world taught you? And I think it's 5 things from the vantage point of the ecosystem. One is these solutions have to be personalized. To AJ's point, this isn't a one-size-fits-all. right? This is going to vary on instance, and instance varies on a person-by-person basis, not the least of which is, for example, social determinant differences. Maybe they don't even have access to the technology, right? So personalization is number one. Number two is this notion of what we call device agnostic. There are a lot of solutions that are introducing new cost, new devices, et cetera. Our philosophy is let them use the device that they already have. It's one less point of friction. And it's one less thing to manage, and it's actually more of a cost-effective solution. You're working within the formulary constraints that are already existing. The third is digital health cannot be a parallel universe. There's a trusted relationship between the patient and their provider. And if you're fragmenting that, it's no good. You have to support the relationship between the patient and the provider. So to the extent that these solutions are integral into the delivery of healthcare with the healthcare professionals, that's a key success factor. Fourth, it has to be trusted. It has to be trusted by both the patient and the provider, which means it has to safeguard the security, privacy, et cetera, of the data. But on the provider side, it has to be something that's evidence-based driven, the same way they would embrace a new drug or a new medical device. And then lastly, the headache won't go away if the Advil isn't swallowed. So it has to be engaging. They have to actually use these things, which talks to the user experience. So we kind of look at those 5 buckets. There's probably several others, but those are 5 that come to mind.
That's really good. I like that. I think it's a nice little quick formula.
Anand is always a tough act to follow. I would say that solutions have to take into consideration multiple factors, including various conditions and diseases our patients have. Because when we see one chronic condition, it's usually polychronic patients, because there's other conditions associated with the predominant condition. So, this is where digital can power with data, power providers with data, power patients with data, but it's, marrying all these various inputs, and options that patients have for their care. That's kind of, I think, what we need to be thinking about.
Yeah, I think those are all good frameworks. I think just a couple of things, I'll try to speak from my provider hat right now. I think when I see patients coming in frequently with, either a notebook full of glucose readings or blood pressure readings, or even an app that summarizes them in a really nice visual flow, a couple of things always come to mind. Please don't give me another portal to log into and another totally separate system where I have to go find and access and then download and upload into my electronic health record this data that is all those steps are just time in my day that I don't have, and I think that's true of the vast majority of providers. And I would say in terms of the solution, always be a little careful, because especially these solutions oftentimes are kind of disease state focused, or they're verticaled around a specific issue or solution that you're looking to solve, which is important for that issue or solution, but oftentimes doesn't take into consideration some of the other reasons a provider might be putting, somebody chose propranolol not because it's the best antihypertensive medicine, but they've got some anxiety and there's some other reasons. So there's a lot of this crosstalk that happens in therapeutic decision making, and that's a silly example, but you can imagine if you're starting to tell them to talk to their doctor about their antihypertensive medicines or their diabetic medicines, but are not taking into account the fact that they've got other stuff going on, either with pain control or with heart failure management, that's going to interface with those medications that you're asking them to talk about. So I think being overly prescriptive can be a danger, and I think that catch-all, go talk to your doctor about this, oftentimes can cause some bristling on the provider side of, I know about this, I've thought about this, that's why we're doing X, Y, and Z, forget that app, they don't know what they're talking about. So I think if you want to engender that trust and really that bi-directional, know your attributes and know your limitations in terms of what you're asking patients and providers to do. And I think just my one tenet from watching patients use these over years is the less yes, it's important to be engaging. The less that you're asking them to do in a lot of situations, the better. The more passive this can be in terms of, yes, I'm providing valuable data, but not asking them to continuously engage, or using so many notifications that you're somebody's head's going to pop off. I think those are important tenets of whatever solution you're designing or looking to implement.
Yeah, absolutely. There's no magic bullet, right? Like if you, during my practice as a gastroenterologist, I noticed there were people who would come obviously with lots of other comorbidities, and the way systems work, unfortunately, you get bounced around, right? You're going and seeing your dermatologist, and then you're seeing your gastroenterologist, and then you're seeing your ophthalmologist, because some of them actually have really severe ramifications, and there's no communication across these, or it takes a long time. By the time these things get diagnosed and you've put all the pieces together, it's really late. But it's not really fair to expect that, yeah, any sort of add-on solution that we're talking about here could also magically just bring all those pieces together, right? So with that in mind, and Alexander, just because you spoke last, curious from your point of view, it's a noisy, crowded market out there, right? If you look at hypertension or diabetes, there's so many products on offer. How do you pick, or how does a certain one stand out from the crowd? And how do you give each one their time in the sun, right? Like you mentioned, we want passive data collection, we want a seamless user experience and all of that stuff, but you only know that when you actually use it.
Yeah, that's a great question. And I think that's something we're all still struggling with, to be honest. I'll say, a lot of what is happening now is we kind of get access and exposure to what we're spoon-fed, and that's either from a system standpoint. So many providers, if not certainly most, if not all, are living under a system in which you're working with or alongside many other healthcare providers. So, Mass General Brigham is a large corporate health system. Many providers, especially in the primary and even specialty care space, are working with or affiliated with these large organizations now. So they're largely taking, an approach where that system is then vetting solutions. Maybe they're using it on their own insured population, but they're, in limited cases, they're kind of using or endorsing one tool or system for their for that specific use case or disease state that they've decided to tackle. Much more often, we're seeing it from the payer side, right, where a payer is, supporting their patient in the way that they're providing access to or subsidizing an app or some solution. So I think that's the vast majority of how we're seeing it nowadays. Is they get some sort of benefit through their insurance coverage, and that allows them access to X, Y, or Z app. And we see a heterogeneous, based on what their insurer covers or provides access to. We're seeing those kind of from the provider side as, hey, here's the app that I'm using, here's what we're seeing. So I think it is a crowded space, and it is a little we're in the days where it's competitive. There's a lot of people trying to I think the way that you're seeing differentiation now is kind of marketing through research, trying to get their data out there, showing results, demonstrating benefit, not only clinical, but financial to patients, hospitals, and health systems, as well as payers. So I think that's where you're seeing a lot of the focus now, because people laying out on the promise of savings, 3 to 5 years from now is a lot harder. The financial decisions are getting, the belt's getting a little bit tighter. So I think people are looking for more sure things, more sure bets, and shorter timetables around which they're going to be seeing the return on their investment in terms of utilization of these types of products. So a lot of it, kind of does circle back to utilization management. It's not always about reducing their 10-year ASCVD risk. Big focus for me in my practice, but not always a big focus for insurers, where churn is a big part of what they see in their patient panel. Is very frequently not the same from year to year, let alone 3 to 5, 7 years down the road. So I think we're looking for data. We're looking for not only clinical, but as well as utilization outcome data. We're looking for short timetables, and I think the vast majority of the customers you're going to see are largely in the payer space as opposed to the health system space. And it really just hasn't gotten major uptake from systems as of yet. That's changing slowly, but that's largely what we've been seeing.
That's very good. Any other perspectives on that noisy market? What are expectations? How do we hone in on the right product or solution?
Everything that AJ said is spot on, so I won't repeat that. I'll just add to it, which is just a couple of perspectives. One is, it's the natural evolution of any technology, disruptive technology in any industry, that you have a lot of entrants at time t0, and then what happens is the number of entrants decreases, and then over time you have consolidation, you have scale. Right. That's the only way that markets thrive. And I think we're entering, and we're slowly entering, and you know, if your cup is half empty person, you look at the industry in the digital therapeutic space in the last 2 years, and there's a lot of people who were there who aren't there anymore. At the same time, if your cup is half full person, you say, hey, to AJ's point, the ones that are still standing are thinking about how do you provide multi-condition platforms, for example. A patient doesn't manage their hypertension in one app and their diabetes in another app, and certainly the doctor doesn't do that either. That's the last thing you want to do for a potentially underpaid, overworked doctor. That's the last thing they're going to do that is orthogonal to their workflow. They won't do it. So where you have consolidation at the product platform level, where you have consolidation at the industry level, and where you have a focus unequivocally on health outcomes in the numerator and economic savings or cost avoidance in the denominator, I think that's what is going to propel this industry forward. And I think we're going to see that as a natural evolution of, this isn't the first time a disruptive technology has been introduced in any industry. So we'll be governed in a certain sense by those types of observations and parameters. But I think our opportunities to do it, we have the additional task of making it safe. We have the additional task of safeguarding privacy and security of the data. But I think even within those constraints, there's a huge opportunity for us to see how this consolidation will continue to deliver value in these healthcare systems and in health payers in the US and elsewhere.
I really like that. And I'll definitely come to business models, because that's a really key facet of all of this as well. But before I kind of switch themes, Julie, Mo, anything to add here?
Yeah, so I'll just add that in general, like when we think about our solutions, as I mentioned, our focus is on evidence-based solutions. So evidence generation and integrated evidence generation plans is something that is a must nowadays. And really, you know, when creating those integrated evidence generation plans, speaking to all your stakeholders and understanding what do they find valuable, because what's valuable for one type of chronic condition, what type of stakeholder is not going to be the same for others. So I think it's really important to kind of, you know, think of solutions not just from the perspective of like point solutions as solutions doing one thing, but also from perspective of like how is it working together with all the other ecosystem stakeholders, and you know, constantly checking in with that ecosystem along the journey of the product, whether you're in the very early stage and developing the product or in the later stage going to market, because the market dynamics are constantly changing and the stakeholder needs are changing as well.
On Anand's point, I think if we could have the best product, right? It solves the right needs, it fills the gap, it's been thought through in terms of best design practices, you know, with the patient in the middle, all of the things we want it to do. But if we don't get the go-to-market model right, then there literally is no point, right? And we've already seen this happen a number of times in cycles in this industry and all other industries. And it's really important, if we truly want to impact a large number of patients, then we need to get the, you know, the business model right. There's been some interesting developments. I might just name a couple that I've seen in the news. Just today, we had the, you know, D2C CGMs that were approved by the FDA, right? And that's a first, and it's really empowering every individual to really take control of what would otherwise have actually been information that only people who lived with diabetes or their physicians would ever have access to. And there's been recent pharma companies that have launched their own platforms to provide access to various tools and products directly to their patients. So lots of other creative solutions. And I think also what Anand mentioned, a lot of consolidation happening, lots of players coming together to form a stronger entity that offers a more holistic offering, right? You have the behavioral therapy elements, you have the actual other clinical sort of elements within the same product by bringing these forces together. So thoughts on go-to-market models that work, that don't work?
Yeah, I'm happy to start. I think that the key thing you said, Chandana, was models and the plurality of not. And I say this with no disrespect, so please don't get me wrong. There are players in our industry who bet their life and their companies on one model, which was the prescription digital therapeutic model. And we've seen largely what's happened to that group of people, because if you require such a large effort from Congress and from the American Medical Association and others to provide codes and coverage and things like that. And it's great. At some point in time, it would be wonderful if those types of things existed, because I think we may not call it digital health. Chandana, in 5 years, we'll call it health. And if it doesn't have a digital component, it's not going to be relevant. Having said that, the plurality of models today is super important, because, as you said, there may be a coded model, there may be a SaaS model, there may be a direct-to-consumer model, and depending upon what condition you're up against, and depending on what geography you're in and what constraints, certain models will kind of rise to the top and certain models may not. And I think there's a certain, dare I say, humility in the DTX community and the digital health community that says, hey, it's not a one size fits all. It's the same thing we said, AJ said earlier on about product architecture. It's the same thing happens for market models. It's not a one size fits all. And I think the market is still not mature enough to know which is the right one. I think we should be flexible. And what we're finding with our customers is sometimes they don't even know what the right market model is. You try different things with them. Certain things stick, certain things don't. You learn quickly, you iterate, and you fail fast, and you move on. But I think that the plurality of models is something we should all embrace, because I think therein will lie the opportunity for us to see, hey, maybe after a year or two, there may be 2 or 3 that kind of float to the top saying, yep, that's where we should focus on as an industry and standardize those things going forward to achieve scale. But I'm curious what the others think as well about that point.
Yeah, maybe even take it a bit further. So it's not just plurality of models as an industry as a whole. It's actually evaluating or having multiple models for every single solution, depending on the stakeholder, depending on on the maybe a particular facet of your solution. Because I think we talked about the availability. You just mentioned that continuous glucose monitoring is now going to be available over the counter. We need to think about, because it's technically like a number of different companies can offer a solution in that space now, support that population that wants to, obtain an over-the-counter device. But what is the offering to that population versus what is the offering of the same solution to, let's say, more of like a conventional diagnosed type 1, type 2 diabetic population?
Just that I do think in certain disease areas, the go-to-market models may be a little bit more clearer. Just thinking of like obesity and weight loss, for instance, that's kind of an area where direct-to-consumer tends to be the most successful. You have patients who are willing to pay out of pocket for solutions that work. Noom is something that comes to mind, and that had early on success, right? And they targeted a market that they knew that patients would be willing to pay a certain cost for a solution that could work. And then I think there's other areas where I think the expectation maybe from patients is that there is another mechanism of payment. Maybe diabetes is one, right? Where these patients have insulin costs and all these supply costs and doctor visits, all these type of things, right? And typically all of their care is covered through an insurance provider. So introducing an external solution, one would expect that the payment for that solution would be covered through insurance mechanisms. Now, I know we just talked about the new glucose monitoring systems that just came out that were over the counter, and I'm curious to see what the utilization of those are from patients who are actual diabetics versus patients who non-patients who are just looking to monitor their glucose for the sake of doing it because they can do it for their health or weight loss or fitness, whatever the other reasons are.
Yeah, and just to highlight something I think that was brought up in the chat. Yeah, so one of my colleagues at Master and Brigham, Ami Bhatt, was one of the authors of the PHTI report that looking at all the diabetes solutions and making recommendations as to the clinical benefits, A1C reductions, cost effectiveness. And, what I'll say is, I think, to steal a phrase from what's been used before, healthcare is hard. These are all companies that I think are doing good, important things, but I think to be able to actually move the needle significantly, I think being a point solution or a siloed solution is rarely going to be successful in a long-term or durable or statistically significant way. I think you really need to be able to thread integrating healthcare providers, activating the patient, and utilizing data and digital tools in a scalable way to actually move the needle in a way that's going to be meaningful and also sustainable. So I think my answer to that report is that I think that I think about it in the same way that I think about AI, right? Like I don't think AI is going to take over for doctors or healthcare providers in any meaningful way, and that's not the purpose of this panel. So I'm not going to dive into that box at the moment. But I think these solutions in isolation, I don't think are going to be enough to move the needle or change behavior. And I think a lot of those challenges that we talked about in earlier questions highlight the barriers to actually impacting a significant sustained change in the outcomes for those patients. But I think that providers that use these types of solutions and integrate it into their care. And I think it's a lot easier to do that from a provider standpoint if that's coming from their office or the health system as opposed to from an insurer. That creates issues with the payment model and how reimbursement and dollars flow in the current system. But I think when it's a single system, a single integrated solution from a healthcare provider standpoint, I think their patients will actually do much better with an engaging, activating platform that the healthcare provider has access to and can make changes based off of, as opposed to a provider in the current world, in the status quo, who's operating oftentimes in a black box, having no idea what happens in the 6 or 12 months in between office visits, unless they get hospitalized or have a significant adverse event that they send a patient gateway message about. I don't think those providers are likely to do better than an enabled provider. But I think that implementation is key, right? Like, how do you actually make that work? How do you make that tool work for that patient and that provider and have it be something that's scalable, right? Like, and not just a one-time short benefit solution. Because I think that's what you saw in the details of that report, was that maybe there is a slight change, it doesn't sustain over time, and it's tough to implement and get providers to make meaningful change based off them. So a long answer to a short question. I think I'll try to summarize by saying, I think they will be used more, but I think the way that they're currently being delivered and reimbursed is a barrier to implementing them. And when providers and patients have easier access and uptake, you'll see more meaningful results.
And if I may,
Anand, just to maybe clarify, because the Q&A is only visible to us, so I just want to call out the question for everybody's. So just what AJ's referred to here, there's a really interesting question from the audience. The recent PHDI report declared digital diabetes management programs cost more than they save based on their ability to lower HbA1c and therefore should no longer be adopted. What is your take on this? I thought that was very interesting, AJ. Thank you. So would love to hear reactions from all of you. Go for it, Anand.
Yeah, no, I was going to hit that straight on. So if you actually look at the Peterson report, all of the companies that were evaluated, we weren't one of them, just for clarity's sakes. All of the companies that were evaluated had digital tools plus human care. That's their business model. So the companies that were involved were all digital tools plus human care. And it's not rocket science to figure out that ROI is not. You're adding cost of digital. Of course, it's going to be more expensive than the status quo, which is already human care. So it's not rocket science to figure out that the ROIs are going to be negative. So in our case, it's quite the opposite, because when you actually provide, and the key word that AJ just said was scalable, when you provide scalable digital solutions that are pure digital solutions, we actually see ROIs that are in the 3 to 5x one, and that too in year one. And where's the source of that savings coming from? We did a study with IBM Watson Health, Truven Analytics, that actually isolated the points of where are we generating value. And there's 3 sources of cost reduction. There's acute utilization reduction, hospitalization, ER visits, doctor's office visits. There's supplies, you know, in the case of diabetes, meters, strips, medications, compression stockings, whatever else they're using. And then there's a third cost, which is a little bit of an intangible in the short term, but it's an important one, which is a cost of comorbidities. So in diabetes, it's the usual suspect 5, right? Hypertension, hyperlipidemia, retinopathy, neuropathy, nephropathy, right? What we're seeing is the lion's share of the cost savings is coming in bucket number 1. You're actually chopping down the number of acute utilization events, which is creating great savings. And so I wish the next report, perhaps Peterson will do, actually looks at this in a true digital sense and actually provides data that's quite out there on what the true ROIs can be. And I think AJ is exactly right. People will start adopting these types of solutions, and they're never there to replace doctors. But this is just me personally, I think doctors who use these tools in the future will replace doctors who don't, because they'll be able to practice medicine better. They'll be able to see what's happening with their patients in between office visits, and they'll be able to use their clinical training to say, okay, that's what's happening with you. Great. Let's work on this, 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 and this, because today they don't have access to any of that information in between office visits. It's a little bit of a void. You go and you see your doctor after 3 months and say, how are you doing? I don't know how I was doing yesterday, let alone 3 months ago. I think these tools will help them improve, if you would, how they provide care, which is what they're trained to do.
Great perspective. Julie?
Well, maybe I'll bring in my pharmacist angle into this, even though I haven't practiced in a long time. But there we have probably one of the most accessible healthcare providers, in our market that historically has been underutilized. So, with situations we have in healthcare where we have shortage of providers, I think we need to remember that the opportunities like digital tools in diabetes can actually, that the patients can bring to their pharmacy and have their pharmacists help them figure out what's the, how they're progressing with their condition, and help them manage their care as well. I think that's like the other side of the equation, where we're forgetting about like various other elements about the health technology that brings.
And I think Mo mentioned a point, which is bringing all the stakeholders. I think everybody on this call actually needs to come together for that business model to be effective and for it to work, right? Would love to hear, how is that working in practice? How are we making it work? So we have pharma here, we have an application in the form of WellDoc, we have a provider and one of the largest health systems in the US. How do all these pieces come together to actually build that go-to-market that we're talking about for scale in a really effective way? Is it even happening?
It's certainly not easy. And also, I think it depends on where you are in your solution building journey. We're developing a program, for example, in heart failure. And, our go-to-market model is very much anchored in working with integrated health systems that can see the benefit of a solution that helps prevent, hopefully helps, manage the healthcare costs for managing the patient. But it's starting out with a limited number of stakeholders at the table, and then hopefully progressing beyond. But yeah, I think it's in US specifically, where we have such a siloed healthcare system, it's really challenging.
Yeah, I'll say, and healthcare systems in general really like to at least try to build it first, right? Especially, academics, where we think of ourselves as innovation shops and, developing a lot of the new tools and technology, doing a lot of the research. So a lot of what my group does is build and deploy technology and digital tools in this space. So anytime our innovation group or our implementation group or our business groups are approached by a company looking to do this, they always kind of try to say, well, are we doing this already? Is there an internal model around which we should build as opposed to buy and license something new from someone else? So I think that's one of the major challenges. And just like health insurers, patients it depends on where you are, but especially in a market like Boston and New England, patients do kind of bounce around between health systems not infrequently. So I think that data disparity can be challenging to overcome. So I think that's those are a few of the challenges that we face. But I think when you try to get the teams together, try to get the incentives aligned so that there's really with the patient at the center, I think that's when you can have a successful relationship develop, successful business model deploy. I think it does take a lot of time, and it takes kind of champions internally on each kind of stakeholder. So I think having the stars aligned for those is less frequent than we would hope that would happen in a happy world where everything works really well. But I think, again, there's a lot of entrenched interests. There's a lot of kind of politics even involved, depending upon your healthcare system or where you've worked previously from a payer standpoint. So I think that those can act as barriers, and I think having one failure makes it much harder to have one success. So for every successful deployment you've heard of, there's probably been 2 or 3 failed either in the negotiation or implementation stage. So I would say that's a major barrier, and especially for large health systems that don't take lightly. They'll do a pilot. Getting a paid pilot off the ground these days is even a painful process, but those are kind of the early stages of these types of relationships where we say, okay, we're going to pick a clinic or a certain geography where we'll pilot this, we'll test it out, we'll see what changes over time, we'll do research on it and study it and demonstrate internally to ourselves and to you that this is actually beneficial or not beneficial. Even when all of that goes well, writing up the implementation contract for much broader scale is a daunting task. So I think you have to have patience, you have to have enough funding and runway to get to the evidence generation, to the contract negotiation, and through deployment, all of which are large, time-consuming. So I think having the right partners, having champions are all really important aspects of the process. Having data is always important, but healthcare is hard.
Well, I guess you've just made a case for consolidation right there, but also I guess that's just the reality, right? We need to have all of those elements. Ironically, I think a lot of the smaller companies, startups actually start their journey with let's fail and learn from this quickly. But obviously, if that failure is actually going to close the doors permanently for them, that is a major systemic challenge, I think.
And I think coming out of the COVID, right, like there was this, Cambrian explosion during COVID, right, of digital health tools, technologies, companies, funding, the funding environment, interest rates were low, money was loose, a lot happened very quickly. I think we're seeing, the evolution of that, which in some ways I think has been previously mentioned, right? Like it's a good thing. You see the consolidation, you see people putting pieces together where it makes sense and trying to incorporate tools and learnings from different companies and products. But I think we're, these are certainly not the bright, shiny days of the past 4 or 5 years where we thought we'd made leaps and bounds in digital medicine, telehealth, and there was this amazing adoption curve that we thought we just accelerated 10, 15 years. I think we're kind of back on that original trajectory with a lot of learnings that have happened in a short time. But I think we're gonna get there. I don't think this. I hope this is not the dark ages for anyone, but I think this is a time for reflection and consolidation. And I think there's going to be a good path forward for those who take stock from what we've learned over the course of the past few years.
I'm going to take the next question if there's no other comments from Julie or Mo or Anand. Okay, here's an interesting question. There's been so much innovation from big tech in chronic disease management. What do you foresee next? Does big tech become the main player providing digital solutions for chronic disease patients eventually?
I'll start. I don't know a lot of doctors who actually like their EMRs. Is the honest truth. Most of them hate them. And that was big tech saying, hey, we got a solution for you, use it, square peg in a round hole. Having said that, I think that there are amazing innovations coming from the tech sector.
Right.
And I think the opportunity is going to be, how do they work in concert with the clinical ecosystem to say, hey guys, we have a capability that can do A, B, C, D, and E that can't be done. It looks like it solves these problems. How do they best fit into your workflow? How do they best fit into into the constraints you have? And I think if we can take the lessons learned from meaningful use and from EMRs and the proliferation of EMRs, which was a cluster when it first came out, if we can take those lessons learned and we can apply them to AI, sensor-based integration, bringing the patient-provider partnership, using data to inform clinical pathways going forward, I think there's actually going to be a lot of innovation that comes from the usual suspects, right? The Apples, the Googles, the Samsungs, the Amazons, et cetera. And I think there's a partnership opportunity, and I think they're hungry for it. I think they're looking forward to working with the pharmaceutical companies, with the health plans, with the health systems to say, how do we judiciously integrate these technologies and move the monkey forward? And I think I'm always a cup is half full person. I think that's where it's headed.
Yeah, I completely agree. I think that one of the biggest areas of failure for a lot of digital health companies is kind of working in a bubble or a silo and hoping that their solution will be the next all be all and not take into consideration of how they form synergies with not only their competition, but other players within that patient's disease journey. And I think, with big tech coming into the mix, I think one, it's gonna facilitate competition, which is always good for the patient, right? I think it sparks innovation. I think it sparks collaboration. So I welcome, big tech players coming along. And, like Anand said, I think that the proof is going to be in the pudding on how they interface and interact with the other players right now who are embedded within this ecosystem. And I'm hopeful that they will, and we'll get to a point where a lot of these solutions are at scale, they're integrated into workflows, and they actually provide, care for patients that actually move the needle in their disease treatment. So I'm hopeful. I think it's nothing but a good thing. But I guess we'll have to see.
Yeah, I guess it's a bit of a question mark because we've seen a couple of closures in recent months of telehealth initiatives and so on, because it didn't give the same multiples that they're typically used to as big tech in terms of returns. And I think this is a different game. So I hope what you're saying is true, Mo, because there's definitely, the world needs that, right? That innovation they're bringing, that technology that they're bringing. In the last 5 minutes, I'd love to ask each of you, really two questions, but to kind of answer, what is the one thing that you believe is really broken and needs fixing, hasn't happened yet? And what is the one thing that excites you the most about chronic disease management in the next 2 to 5 years?
Maybe I'll kick us off this time.
Go for it.
I would say, I'm not going to mention reimbursement because I think everybody on this webinar knows the challenges around reimbursement. But I do hope that where there's an opportunity is create solutions that are truly holistic in nature and combine all types of modalities and personalize those modalities to each patient and meet them wherever they are in their patient journey and however they want to manage their patient journey. So I think that's I think like one area.
So you're looking for something that's like a WeChat of chronic care management. maybe, or for like a better analogy, maybe like an Amazon type of solution where there is personalization and the patient wants to be very actively engaged in their care and focus on being a very active participant. The tools are available, and then for those that don't want to be an active participant or maybe want to skew more on the traditional healthcare type of solutions, then have them have that, but have those decisions be powered up by data. And that's where healthcare technology plays a role.
I think the opportunity or the challenge is what we talked about, how technology collaborates with the ecosystem. and that's key, but that's a solvable problem. So, you know, I don't view it as an impediment. It just has to happen. I think what excites me the most, guys, is the iPhone came out in 07 and we're in 24 today. That means the iPhone generation is 17 years old and they're 4 years away from going to medical school. And they're not going to want to graduate with a stethoscope that goes thump, thump, thump. They're going to want to graduate with a set of tools that's all they know how to do. Their whole life is built around this device. And I think there's an inevitability of this. The next generation is going to take it forward with a velocity that we don't know, we can't comprehend. Our opportunity is to guide it so that it happens responsibly, judiciously, securely, all that good stuff. But that's the thing that excites me the most. It's coming. We have to guide it to, you know, to grow and flourish appropriately.
Love that, Anand. Who wants to go next? Mo? AJ, go for it.
Sure. Yeah. So I think what's broken and needs fixing. I think there's this enormous supply-demand mismatch. If you look at you know, both the patients living with chronic disease and their access to the healthcare system, and then on the other side, you look at providers and rates of burnout and step back, especially from areas like primary care. I think that gets me nervous, and I think it needs fixing. It's not a single, you know, there's no silver bullet for it, but I think, you know, digital tools, technology, scalable solutions, team-based care, greater utilization of things like APPs. I think those are all necessary. But I think that's what gets me, like, what keeps me up at night. That's what keeps me up at night. I have somebody hospitalized for heart failure and I can't see him in clinic for 6 months. You know, that's not great for the patient or for the system, and it makes me feel bad too. So I think that's the one thing that I'm really nervous about. In terms of what's coming in the next 3 to 5 years, that gets me really excited. I think, you know, I think it is going to be a little bit of what's been discussed before, this, you know, pulling the pieces together, because I think we've seen a lot of tenets of solutions that are effective, and we've whittled through those over the course of the last couple of years and learned an enormous amount, both about how patients and providers want to interact, both consume and deliver healthcare and healthcare data. I think as some of these tools and technologies evolve and become even more passive in those things, I mean, wearable sensors, and we can, you know, there's really cool research. CGMs are great, amazing that they're, you know, now approved for over-the-counter use. I think now we're saying, oh, what about, you know, do you even need, can that be a wearable, right? Like there's some really cool research on, you know, using sensor-based technology to gather that data. But that data and tons of other data that I think is going to just add to the wealth of information we know about our patients. So what I think is exciting is we've been able to gather that data now for a number of years, and all the way going back to like the sensors that are incorporated with your phones that people carry around in their pocket all day, every day. I think the revolution is really going to be in what do we do with all that data? And how do we actually turn that into action and actionable items, both from a provider and a patient standpoint, that actually bends the curve? And I think a lot of these new tools, both in sensor as well as, you know, AI chatbots right now, hiring a health navigator, it's an FTE that's very expensive. It's not easy to do that at scale, but using some of these new technologies to check in on somebody. And I think that concept of not only health, but health and wellness. So it's a mental health, behavioral health, incorporating those things into that solution, I think is going to really change the way that we deliver and receive care.
You're a huge optimist. You've painted like this incredible picture of where we're headed. I love it. Last 30 seconds, Mo, for you, and then obviously we can wrap it up.
Yeah, I am going to talk about reimbursement because, you know, companies need to differentiate themselves, right? It's a crowded space, and differentiating yourself through evidence generation and data is expensive, which in turn leads these products to be at a higher cost. So there needs to be a mechanism for payment, especially in certain disease areas where patients may not have the ability to do so. So I think it starts with Washington and CMS and other pathways to start kind of dropping that first domino. So that's an area where I think it needs fixing. And then as far as what I'm excited for, you know, we're kind of in the renaissance of digital right now. You know, there's this whole reconfiguration of our industry to where patients and how patients are treated in their homes. We have these new emerging technologies, and then we have patients who are demanding from an equity perspective, from a technology perspective, access to care in a different way. So, you know, I think we're kind of in a in a boiler right now, and a lot of these things are cooking, and I'm hoping some of these things pop off over the course of the next couple of years, and it really allows us to take off.
Terrific. On that note, just want to say thank you so much. We've had a bit of a whirlwind hour, but try to touch on all the different things. Just want to thank all four of you so much for joining us today, and to everybody else in the audience as well. We will catch you on the next HealthXL session. Until then, see you later.
For having us.
Bye.
Bye.